Welcome everybody. Can I remind you that you may use either the chat box on the channel or the link to the Google Doc to ask questions. And you can do so throughout the talk, and we'll queue them up and ask them to the speaker at the end. Right, today we are very pleased to welcome Professor Daniel Nettle as speaker for today's EMPH seminar. Professor Nettle is a behavioural scientist at the Newcastle University, where he studies mainly humans, but also starlings. The breadth of Daniel's intellectual influence is evident in his wide range of research. He has published papers and indeed written books on personality, happiness, early life adversity, mental health, aging, and obesity. His work on cooperation, parenting, and social capital, with a focus on Newcastle neighbourhoods, has provided a rich narrative with which to better understand social inequality in the UK. Today, Daniel's going to talk more about this with seeing people in poverty as rational or perhaps adaptive actors. Thanks. Over to you, Daniel.
Thank you very much, Paula. I'm just going to share my screen. And I hope that you can see my title slide now. Thank you very much, Paula. It's lovely to be here. It's lovely to be invited. I'm very sad not to be in Oxford, being able to talk to you in person, but it's a welcome opportunity to reflect on some of my research and try and put it together in a new way. So my talk was originally entitled Seeing People in Poverty as Rational Actors. And then I thought, well, this is an evolution medicine and public health seminar, and not just a medicine and public health seminar. So I really also need to think a little bit about whether when we say rational, we mean adaptive, and to what extent a specifically evolutionary parsing of what I mean by rational might be useful and might indeed be possible. So here we are, seeing people in poverty as rational or perhaps adaptive actors. So I've been spending a lot of time reflecting on my work over the years, and I began to notice that perhaps, rather to my own surprise, there's a fairly coherent thread there to do with the behaviour of people living in poverty. And really looking back, the very first paper about this is from 2008, 2009, when I was kind of mulling at this idea. And then I sort of forgot about it for a bit, came back and tried to present the idea in a different way. And there's sort of every couple of years over that period, there's a sort of attempt to gnaw away at this particular idea in a better way. I've put the idea out there. I think in general, it's had no impact at all, and no one has understood what I'm talking about. And indeed, have very often taken me to say something more or less diametrically opposed to what I'm actually trying to say. Now that's very interesting. It could be that I haven't said what I'm trying to say very clearly. So here I go, having another crack at it. But it could also mean that the idea I'm promulgating is going against a really deep headwind of people's assumptions about the behaviour of people living in poverty. And I think that's really interesting. When you say something that people continue to misunderstand and misapply, despite your attempts to be clear, that's often interesting because it shows us where there's a muddle, or where we're facing some intuitive or cultural obstacle to understanding. So here we go. Let's see if it goes any better today. In developed societies like the ones I study, people living in poverty behave in really, really different ways from people who are affluent. And these differences are very striking. They often dwarf the relatively small differences between countries, right? So if you're interested in the difference between the UK and Japan, the average difference between the UK and Japan is as nothing compared to the difference between rich people here in this city of Newcastle that I live in and the behaviour of poor people who might only live hundreds of metres away or tens of metres away. So these intra-population differences are very, very striking. For example, people living in poverty start to have their families at a much younger age. I mean, a decade younger than people living in affluence, who often live in the same streets and the same cities and have their children in the same hospitals. That's very interesting. Why would that be? People living in poverty eat really different stuff from people living in more affluent conditions. So this is a restaurant called Pizza Addict. It's about 150 meters from my house. You could go and do a study of the people living in there, and people that they're not living in there, the people who are going in there to eat. And what I can tell you now is that their incomes will be very low. And this is somewhere that people with low incomes eat, and that's a huge marker, right? It's not proximity of that restaurant to where you live, it's how much money you've got that really determines whether you eat there. And there are other more sort of subtle differences. For example, on measures of consideration of future consequences or future-oriented behaviors, or temporal discounting, these kinds of ideas of, would you take one marshmallow now, or are you prepared to be patient for two? You find these kind of fairly reliable socioeconomic differences. So the big question is why? Why do we find these striking behavioral differences? Now, people from different sort of political standpoints, or intuitive political standpoints, tend to think of these things very differently. So if people coming more from the right will tend to say, well, these behavioral differences are kind of because the poor are feckless, and they're the causes of all their problems, because they can't delay gratification, and they've got poor impulse control or poor cognition, and this is why they do all these these kinds of things. And people coming more from the left will tend to say, well, people do all these things, but it's not their fault. It's this kind of the structural conditions of society make people incredibly stressed, or oppress them, or in various ways sort of disfigure their cognition, so they end up doing all this stuff. But what both of those perspectives share is the unstated but very definitely there assumption that people living in poverty are getting things wrong. Okay, so whether you think society gives you such a bad deal that you're stressed and in a scarcity mindset all the time, so you can't make good decisions, or whether you think you can't make good decisions because you're constitutionally feckless or whatever, both of those assumes that the decisions themselves are bad. They just differ in their account of why people living in poverty make these poor decisions. But in a way, I suppose the idea I've been worrying away at for 10 years is, what if these weren't bad decisions? What if these were actually optimal, or if you don't like the word optimal, the best possible decisions that humans could come to, given the constraints under which people living in poverty are making them, right? So that's a really radical idea. It challenges both the kind of, we've got to support people emotionally to make better decisions, and the people are poor because they're poor at decision making perspective, and actually says, what if we consider a radical alternative that these are actually the smartest things to do given the available set of options? And that's really the idea I'm sort of exploring today. Two sources of inspiration for this work, really. So one is the discipline of economics, which actually I find, perhaps paradoxically, given the sort of particular political reputation of economics compared to disciplines like public health or sociology, I find that the portrayal of people in poverty in certain parts of economics is much more sympathetic to people in poverty than the portrayals in, say, economics or developmental psychology. And I think that's really interesting and somewhat counterintuitive. But there are serious works in economics, for example, the work of Gary Becker, that basically take what I view to be a very interesting approach to people living in poverty. So, for example, in this classic paper on crime and punishment and economic approach, Becker goes against decades or centuries of thinking that people who commit criminal acts have got something wrong with their brains, right? They've got phrenological deficits, or insufficiently developed frontal lobes, or some other kind of structural problem with their brains, and therefore they just make these bad decisions and do these obviously irrational things. And Becker says, let's forget all that. Let's just say, what if you were a rational actor, and there were some things that were true about the world you lived in, like what are the returns from legitimate activity? And that determines the opportunity cost of doing illegitimate activity instead. What's the cost to you of a punishment? What's the probability of that punishment? What's the utility you could get through criminal means as compared to that you could get through legitimate means? And whether or not these models are right in detail, what they say is, let's just take people in poverty seriously as decision makers, without assuming they're worse decision makers. They're just decision makers facing a particular set of options. And Becker, as many of you will know, goes on to actually study lots of really interesting phenomena like addiction, and rather than just saying this is when the brain goes wrong, says, well, when might it be rational to become addicted, right? And again, he does the usual economist thing, what's the utility of the pleasure you get from your addiction? What's the opportunity cost and all that? Again, I'm not interested in whether that's right in detail, but I think it's philosophically really interesting that rather than seeing addicts as making a mistake, he sort of says, well, what would it do to just assume that these were normal human brains making decisions in a very particular ecology? So my first source of inspiration is that kind of stream of work in economics. Whether or not you like kind of rational actor economics, you've got to give them the credit that they treat people in poverty, at least in this work, as in principle the same as anyone else, and I do like that. Second source of inspiration is animal behavioral ecology. As Paula said, as well as working on humans, I work on starlings. So one of the things we see about the starlings in sort of May, June time, when they're feeding their young, the starlings really prefer to feed on soil invertebrates. They like to probe in the grass and get the larvae of crane flies out for themselves and for their young. But when the weather's very dry and the ground gets very hard, they can't do that anymore. So they actually have to start finding other stuff. So they start to eat grains, and they start to go into pig farms and eat the pig pellets and so on. And nobody says, oh, you know, these starlings, they're so, you know, these starlings living in poverty, you know, these starlings facing a harsh environment, they make such bad decisions. It's because they've got this scarcity mindset. You know, we need to emotionally support them to make better decisions. Or we need to like label the pig pellets with, you know, red, this is not good food for starlings, you should go and eat something healthier instead. We take their decision making seriously and say, well, these animals have survived for millions of years, so they're probably pretty smart. So if they're doing that, it's probably because that's the best possible thing that they can do, given the set of options that they face. And there's lots of nice theory in behavioral ecology that exactly says that, you know, when the stuff you really want isn't available, you need to switch to other stuff, and it might be less good for you, but it's just what you have to do, and you can work out the kind of predictive consequences of that. And likewise, you know, there are all kinds of models of apparently self-damaging things like senescing, that is your body going unrepaired and stopping functioning so that you die, that on the face of it seemed obviously a mistake. Why would any animal, you know, choose to senesce? But there's a long tradition of work in behavioral ecology saying that there might be circumstances where you might actually choose not to maintain your body so that you senesced. For example, if it meant you could do more reproduction earlier in your life. So all of this work is, you know, it's kind of suffused with the assumption that when animals do things, it might be because there are good reasons rather than they're just getting it wrong. And that's a source of inspiration to me. Of course, there's a huge difference between these two bodies of work in that in the economic work, we assume that the individuals are maximizing something called fitness, something called utility, which is a kind of notional currency that kind of integrates the various kind of goods people are interested in. Whereas in the animal work, we sort of know what the currency is. The currency is fitness. The currency is remaining alive and making more starlings in the future. And I think there's an ambiguity running through all my work in the previous decade that sometimes I kind of assume that this thing that people in poverty might be making a good job of maximizing is their utility. And sometimes I sort of assume or imply it's their fitness. And I have a kind of constructive ambiguity about that, which I think is a weakness of my work. I've never really got to the bottom of my account of what is this thing that I think people in poverty might be, you know, managing to maximize given the constraints they face. But I suppose we could fudge that issue, or maybe we can come back to it in questions, but we could fudge that by saying actually animals don't directly maximize fitness. For many kind of day-to-day decisions or hour-to-hour decisions, what they're maximizing is some intermediate proxy currency. So that, you know, the starling is maximizing its rate of caloric return or something like that. And I think we could, in many cases, say the same about humans. They're not, you know, no humans living in contemporary Britain are maximizing their fitness because family sizes are so small. So clearly, you know, neither people in poverty nor anyone else is maximizing their fitness. So we can't make that assumption, but we can make a kind of reasonable intermediate assumption that people are maybe trying to maximize or at least defend some currency, like having enough calories in your body and, you know, being able to do things that are socially rewarding, and being able to have at least some kids while you're still in good health and stuff like that, which are kind of intermediate currencies that over ancestral environments would have reliably correlated to fitness. But I think the whole relationship of what actors in contemporary societies are doing and how that relates to fitness, which is a kind of ancestral quantity, is an unsolved one in our discipline. I'd love to talk about that if we get time. Okay, structure of my talk today. I've got 3 examples of work by myself and other people that I think illustrate this general thesis that we should take the decision-making of people in poverty seriously. The first one is about age of childbearing. The second one is about poor diets. And the third one is about preventative health behaviors. And I'll just go through each of those for a short time. Then I want to speculate more broadly about why people in many academic disciplines seem to struggle with this view. Instead, they're very, very wedded to the view that the decisions of people in poverty must always be mistakes. They seem very intuitively wedded to that view, and I'm kind of interested in thinking about why that would be true. And also, I want to think about the implications of both the widespread view that the decision-making of people in poverty is always mistaken, and this alternative view that I'm promulgating, and say, well, what are the kind of implications of that for how we think about doing our work and acting upon the world? And then I'll conclude. Okay. Example 1, age of childbearing. So one of the most striking things about Britain, or any other developed country, but it's particularly marked in Britain, is that the age at which you have your first child, if you're a woman, is a highly socially marked variable. So this was a study I did years ago. So taking neighbourhoods of the English census and looking at the mean age at first birth of women, and neighbourhood quality there is basically the decile of the income distribution. That's what it amounts to. It's a particular variable that amounts to that. And what you see is there's this very smooth relationship that in the poorest neighbourhoods, the average new mum, first birth new mum is about 22, and she's about 30 in the richest neighbourhoods, and that's a very big social gradient, right? It dwarfs the difference between the UK. It's as different as UK and Zimbabwe or something on average. And we all know this, right? I mean, there's no mystery about that. Right? It's not like I discovered it or anything. But it's a striking fact that a lot of people have worried about and moralized and come up with interventions that they need to address this. And as I'll argue later, a lot of these interventions are kind of predicated on the idea that this is some sort of big mistake, right? That teen motherhood is a problem, and that poor women are making some kind of very self-damaging mistake by doing this, and that we really need to intervene them to help them not do this, and so on, because of alleged negative consequences that follow. By the way, as regards to whether negative consequences do follow, I think that's actually not so clear-cut as people often assume, and I refer you to the great work of Arlene Geronimus if you're interested in that kind of issue. But anyway, here's the phenomenon. It's something that a lot of people in public health, particularly in the UK, where for a decade in the late 90s and the early 2000s, we had this thing called the National Teenage Pregnancy Strategy, which is a multi-million-pound strategy to try and reduce early childbearing amongst poor women. That really felt that this was a problem, and this was a gradient that needed to be flattened. First, we looked at, can we really say that early childbearing is a mistake amongst women who have their children young? As it happens, there's a rather unique data set called the National Child Development Study, in which British girls were asked what would be the ideal age to have a first child. Okay, so we actually don't just know, and then we do know the age at which they did have a first child subsequently. So this is a rare case where we know what they think they were trying to do, and we also know from follow-up information what they actually did. And it turns out there's a really tight correspondence between the two, right? So firstly, socioeconomic position doesn't just predict the age at which you will actually have your first child, it also predicts the age at which you say it would be ideal to have your first child. And remember, they said that before they were pregnant, right? They said that at age 16. And moreover, there's a really strong relationship between what women say they want to do and what they actually do. On average, of course. Some women, overshoot or undershoot by several years, but on average, people are pretty accurate. And if you look on this graph from this paper, what we did is we looked at the age that that women intended to have a first child and the age that they actually did. And what we find is, first of all, there's a certain number of working class women who were aiming for 16 or 17. And their problem was not that they fell pregnant too young, it's that they didn't fall pregnant young enough, right? They were aiming for 16 or 17. On average, they only managed 20, right? So they overshot their ideal by a year or two. But otherwise, generally on average, people are pretty accurate. They do more or less what they pre-registered that they wanted to do, okay? So this is sort of an interesting finding that I think gives the lie to the fact that early childbearing is always a mistake, right? Because there's a unique data set where women had actually pre-registered what they thought would be a good idea to have a baby. And that related very systematically to the sort of context that they were growing up in. So that's all fine. What it means, though, is when you have something like the National Teenage Pregnancy Strategy, I just want to point out that what you're intervening on is the right of some working class women to do the thing that they think they would really like to do in their life, which were you to do that about something that middle class people want, you'd probably view that as an illiberal strategy, right? But because it's working class people, somehow that's all right because they're obviously getting it wrong. So I just want to point out this sort of strong normative set of assumptions embodied in that particular strategy. Okay, now to the more difficult issue. Is it definitely a mistake to have your children younger if you live in a poor neighborhood? Well, what do we know about such neighborhoods? One of the things is that the expectation of healthy life for women is very much shorter in low-income neighborhoods, really much shorter, like in the low 50s or mid 50s in England and Wales now for the poorest neighborhoods. So actually, your sort of available span that you could rationally expect is really very different to, if you were in a more affluent community. So in one study, I just calculated the simple kind of thought experiment, the simple heuristic. And I said, well, let's say that you want to follow the heuristic. I want to have my children as late as I can afford to, but at such a time that on average, I can expect to still be in good health when my oldest grandchild is 5 years old, right? So that's just not an unreasonable desire that you might have in life. I'll still be around till my kids have grown up and had kids of their own, and that might be a reasonable sort of maximum that women were seeking to achieve. And I just calculated for different neighborhoods where we know the expectation of healthy life. What age would you have to start in order to actually fulfill that heuristic? So what's the last age you could afford to start? What this figure shows is the line shows the ages that satisfy that heuristic. So the latest you can afford to wait if you want to still be in good health on average when your oldest grandchild is 5 years old. And this is also assuming that your daughter starts her reproductive career at the same age that you did. And indeed, this rule fits what people actually do really, really well. So people in the poorest neighborhoods are waiting about as long as they can afford to wait if they were trying to fulfill that particular heuristic. Now that heuristic is very simplistic. I'm sure it's not the whole story, but I think it makes the point that it's not so obviously done, right? It took me, a few minutes as someone who doesn't know much about these things to kind of come up with a rule that actually really makes the behavior of people in poor neighborhoods pretty rational. Now you might say, well, yes, that says you should have your first baby at 22. It doesn't say you should have it at 16, to which I agree. But of course, some individuals within the poorest neighborhoods are in far worse states than the average for that decile, and they may know that they are. So they may wish to go even earlier, right? So from this kind of data, it is simply not obvious that this is a bad age to start childbearing. In fact, there are all kinds of other biological reasons why late teens and early 20s is a pretty good age to have children. You're really fertile, you have fewer obstetric complications, and so on. So the assumption that it can only be a mistake to have your first child young is sort of deeply embedded in assumptions about the kinds of futures that are available to middle class people versus people living in poverty. I think you get the general idea. Okay, so I'll move on to my next example. This is the example of poor diets. And I'm drawing here not on my own work, but on the work of Nicole Darmon, who's a very good French researcher, whose research I think is extremely interesting, though not couched explicitly in any sort of evolutionary framework. One of the things that Darmon's done is calculate the energy cost of different categories of food, right? So that's how many euros per megajoule or per kilocalorie, if you like, does this food cost you? And you'll see that there's vast orders of difference between white bread and sugar and pasta and so on, and things like fresh fish and leafy vegetables in terms of how many calories you're getting for your buck. You will have immediately seen that all of the things that we tend to say are healthy foods that people should eat are really quite at the top end of that graph, and a lot of the things that we denigrate as unhealthy choices are down the bottom end. So here I am talking to you from the north of England, whereas many people in many working class households, a traditional meal in the afternoon or evening was a sugar sandwich, right? White bread with sugar in it. Now, you might say, oh, that's terribly unhealthy, you should, eat broccoli or whatever. But if you look, when you ask a person to eat broccoli rather than a sugar sandwich, you're asking them to switch feeding their families from something that is actually extremely cheap per calorie to something that's remarkably expensive, that's going to actually eat into their budget much, much more. It may well have other health benefits, of course, that's true. But I'm just pointing out that what is quote unquote healthy and what is expensive are highly related, and therefore it's very easy from a middle class perspective to say you should eat leafy vegetables and so on in your diet. So that's the first observation I want to make. The foods with the lowest energy cost are those deemed unhealthy, but the ones we think of as healthy cost a lot per calorie. Now, this is a beautiful study, okay, and it's going to take some explanation of how it worked. This is a great study that Dalmont and colleagues did of diets in a certain area of metropolitan France. And what they did was they first calculated what is the average diet in terms of macronutrient composition, cereals, dairy, fats, fruits and vegetables, and so on. And that was the one shown here that costs nearly 4.5 euros per person per day, which is what it cost. These are prices from some 20 years ago. And you can see that it has this kind of composition that, people eat not very much sweets and a certain amount of fruit and vegetables and so on. You can read off the proportions there. And then they create a linear programming algorithm. There's basically a model that's what it's trying to do is say, okay, you set it these constraints. Firstly, get as many calories per day as the average diet of the population. So get as many calories per day as the diet that costs about 4.4 euros, which was the average diet of the population. Secondly, have a proportion of those major food groups that is as close as possible to the average diet of the population. But thirdly, respect the maximum budget constraint that we're going to give you, which is a variable that the experimenter or the researcher can set, making the constraint on how much you can spend ever more exigent. So that's what they do, and what I'm doing on this axis is the cost constraint gets ever more tough. So here you only have 3.5 euros a month to spend, there you only have 2.5, and there you only have 2, and so on. But remember that the algorithm is trying to find that diet which is as close as possible to the average diet, is isocaloric with the average diet, so it's got the same amount of energy in it, but only costs the specified cost constraint. And as the cost constraint becomes more and more severe, you give people less and less money to spend, lots of things happen, right? They start to eat more cereals, they start to eat less fruit and veg, that goes pretty quickly. Their consumption of lean meat and fish starts to go down. And as the constraint becomes really severe, they start to actually use a lot of sugar, sugar-sweetened beverages or sweets. Okay, because that's a really cheap way of getting calories. So, what I find extraordinary about this model is that it actually predicts really specifically lots of things that are true about the diets of people living in poverty, the switch from wholemeal to white bread, increased use of sugar when you really haven't got very much money at all, the dropping out of certain types of vegetables and stuff like that. They predict all that really, really well, just from this dumb, simple rule. You've only got this much to spend, but you really want to. So this algorithm, it really wants to have a healthy, balanced diet, but it's only got so much to spend, and it gets as close as it can. And actually, they show that the cost, just including the cost constraint, leads to a model that predicts the behavior of people living on low incomes really pretty well, actually. So I think there's a lot we can explain about why the poor eat poor diets, which is not based on poor decision making or lack of information, but simply on the cost constraints that they do in fact face. And okay, so people are, at this point in my talk often sort of say, well, that's true, but that can't be the whole story, because actually poor people are fatter. People living in poverty are more likely to be obese, right? So it can't just be that they're eating isocaloric diets on a lower cost. They must actually be eating more calories. This is particularly true of poor women, who are much more likely to be obese than rich women. But I just want to point out that that's actually a fallacy, because there is no evidence that poor women consume more calories than rich women in societies like the UK and the US, nor indeed that actually the number of calories you consume per day predicts your body mass in any way at all. Okay, so people intuitively think, well, if you're fat, it's because you eat more calories. Well, it's true at the individual level. If you stopped eating calories today, you would gradually lose weight. But it doesn't follow that at the population level, the predictor of how fat people are is the number of calories they eat. Actually, it isn't. It's a completely null predictor. And so this is just some data from a paper of ours, where you can see, right, what are the variables that predict someone's BMI. So this is from the NHANES, which is a big American representative data set, where we know a bunch about the diet, the dietary consumption from food diaries that people had. And we also know a bunch about we know their BMI. So what are the standardized associations with BMI and various variables? So one, their daily calorie consumption is a totally null predictor, right? So fatter people are not consuming more calories, and people who consume more calories are not fatter. What are the predictors? Well, people who eat less fiber are fatter. So the amount of fiber you eat is a negative predictor of BMI. And that's interesting in view of various theories to do with how adiposity relates to things like the gut microbiota. People who have less diverse diets are fatter. Again, that's relates to various theories about the gut microbiota and the absorption of nutrients. And people whose consumption of food is temporally variable, the same number of calories, right, but you're just getting them on a less regular schedule, are also fatter. And that actually relates to various kind of theories about animal fat storage and the hormones that are involved in that. But also, when you're living on a really low budget, one of the things that starts to happen, and we're just doing a study now in the UK that shows this, is that your consumption of calories starts to be temporally irregular, because you have gaps, right? And you have often irregular lives and irregular availability of money. So actually the reasons that poor people might be fat are really probably nothing to do with them having more calories overall, but perhaps to do with other subtler features of their diet, which again may be imposed by the kind of constraints that they are under. Okay. And then finally, on this example, I just want to make this point that a lot of people agonize about how can we get people to eat more healthily, right? And we agonize about this in the sort of health psychology literature. This is viewed to be a sort of terrible, hard problem. We don't really know, we give people information, they still eat unhealthy, they still want to eat their chips and so on. I would just like to point out that we know perfectly well how to make more people eat more healthily, which is give them more money, right? We know that it works, and we know it works not just from cross-sectional studies, but from randomized control trials. And this is a really nice one by the same researcher, Nicole Dalmau, who just shows that an intervention, in this case, that didn't give people more money, but it subsidized them to eat foods, so subsidized food, either in a very specific way to fruit and vegetables or in a more general way. And they show that what happens, well, fruit and vegetable consumption goes up, and consumption of unhealthy products goes down, right? So there's no mystery. How do you get people to eat healthy foods? Well, there might be all kinds of subtle things you would do at the margin, but one of the things we know really actually does work is you simply alter the price of that food, or you give the people more money, and actually, the change in their food consumption follows exactly as Dalmau's model predicts that it would, and in fact, as her randomized control trial shows that it does. So when we kind of, scratch our head for some sort of evolutionary reason why people would really like, sugars and fats because they have some sort of nonsense about them on the savannah, or, some sort of flashy way of nudging them and so on, let's not forget that we know how to make people eat more healthily, which is make them less poor, right? So we'll come back to this later. Okay. And then my next example is a more general one, which is to do with preventative health behaviors. This is a favorite cartoon of mine, actually. It was Gillian Pepper who drew my attention to this cartoon, where there's a couple of guys in a war zone, bombs flying over their head, and one of them's lighting up a pipe, and the other one's saying, Jesus, John, don't you listen, Side says that drugs are dangerous. And of course, that plays into the various obvious intuition that you probably have, that if you were going to had a reasonably high probability of dying in the next few weeks anyway, because there were bombs overhead, you probably wouldn't worry terribly much about, subtle long-term health costs like using drugs or smoking and things like that. And that's a sort of very obvious intuition, but it's something that hadn't entirely clearly been made, or at least not in a way that to my satisfaction, in the sort of health psychology literature. So I had a go at trying to make the point, and no one paid any attention or understood what I'd done until Gillian Pepper came along, and then she did a much better job in her PhD of trying to kind of promote that idea. So this is the original model, which, just as a sort of bitchy aside, lots of journals like Social Science and Medicine, so here's am I saying, why do people in poverty not look after their health? And social science and medicine said, oh, this is not of interest to our readers, right? We're interested in the intersection between social science and health. And I was like, okay, I'm doing something wrong here. But anyway, I'm sure you've all had that experience. What we have in this model, okay, is a world where individuals face threats to their health, things that might kill them, of two categories. Ones that they can do something about, and they can minimize through health behavior, right? So they can go for screenings and, make sure to follow health advice and follow medications and follow guidelines and all of that. Or they can not do that. They can not invest effort in doing that. So they can invest in controlling the things that they can control. But there's also a rate, a background exogenously given rate of things that are just going to kill them off anyway, right? And we call these this uncontrollable or extrinsic mortality in the model. And so there they are. They're in a world where there's a background rate of these kind of bombs falling on their head, and their task is to decide how much to invest in preventative health behaviors that will have a positive impact in the long run on these kind of controllable things. So the first sort of obvious point to make is that this background rate of bombs falling on your head, the uncontrollable things, really affects the return on your investment in the controllable things. Okay, so when the rate of uncontrollable mortality is very low, say 1% a year, then the payoff for actually looking after your body becomes really big, because that body probably will be around a long time, right? So you might as well invest in it. Whereas, in the world where bombs are going off 3 times as often and you can't do anything about that, actually the return on investment in these voluntary health behaviors is much less, because on average, you will be cruelly snatched away before those investments are fully paid off. The analogy we could use here is, in a world where cars are stolen or vandalized, at a high rate per month, do you invest in kind of lubricating the gearbox or some relatively subtle intervention that might prolong the life of the components? And the answer is, well, probably you don't, because it'll probably be gone before you'd ever see any kind of payoff from that. And then what I go on to show is that if there's a trade-off, if there's something you could be doing with your energy now that gives you some sort of benefit, and I'm murky on what that benefit might be, but that's some sort of benefit, then actually the rate of this background uncontrollable mortality dictates the optimal amount of investment in your own health to do. So that just captures that intuition that in a world where things are going bad for reasons that you can't control, you're really not going to kind of try too hard to look after things in the long term. So what I was trying to do here is provide a kind of motivating model for the widespread observation that people in poorer communities have higher rates of temporal discounting or less future oriented, or however you want to kind of characterize that particular variable. And I think the model does have some interesting implications. I mean, one of the obvious ones is that if you can improve the lives of people in poor communities, make those lives safer and less full of uncontrollable threats to their health, you'll get a sort of double blessing from that, because the primary effect will be, well, that's a good thing to do anyway, because their health will get better. But there'll be a multiplier, because what will happen is they will see that their long-term prospects are getting better, and according to this model, would spontaneously respond to that by starting to look after themselves better. They would start to worry about all the things that don't happen in poor communities, like wearing seatbelts, or now wearing masks, or these kinds of things, because they've got an asset to protect suddenly, right? They've got a future that they should feel less fatalistic about. And of course, that's an account of how health has improved over recent decades in middle-class communities, right? Health inequalities have got so big, partly because the ecological context of middle-class people has got better, and then they've doubled up on that by suddenly becoming much more health conscious and following all kinds of guidance and taking up screening and being really health and safety conscious and so on. So there's been a kind of multiplier. And in poor communities, the environment hasn't got better at that same rate, and people haven't also wanted to do the things that they can do to the same extent. So the argument here is actually, if you can intervene in a level that makes the whole environment more favorable, people's behavior, there'll also be a behavioral shift, right? A spontaneous one that you won't need to coerce people to do. It should just happen. That's the sort of argument. you can see Gillian Pepper's work for, for kind of development of this idea. Okay, so that's my general kind of pitch, that in these three areas, maybe the behaviors of people in poverty might not really be such obvious mistakes after all. Of course, individuals might make mistakes, but then affluent individuals make stupid mistakes all the time too. I'm just saying that there's really no reason for thinking that systematically people in poverty are making worse decisions than people in affluence. I think some people sometimes make good decisions and sometimes make bad ones, but I think that's equally true of people in, in both sort of sets of conditions. I just don't think there's perhaps the obvious basis for saying, but the people in poverty, are really, really, much worse on average. They're just in poverty, right? That's the big difference. And therefore they're facing different sets of options. And all of my examples kind of illustrated that. But what this in a way seems to me a really obvious point. And actually I must say, when I present this to economists, they say, oh yeah, well, I get that, because they're so sort of schooled in the rational actor approach. They say, well, yeah, okay, that seems intuitive to us. But actually disciplines of public health and sociology and so on, this, particularly public health, this kind of comes as quite a heretical sort of statement. And so much so that people will quite often, they'll come to my talks and say, oh, that's really, really interesting. And then they sort of look at me and kind of say, but you don't really think that poor people eat crap because they haven't got enough money. And I say, yeah, well, I really do think that. I really think people haven't got enough money. I think that's the problem. They go, but you don't really think that, and then they say things like, but you don't really think that, young women have their babies young, because they think it's a good idea, because they haven't, not going to live that long. And I say, well, yeah, I kind of really do think that. And they say, but you don't really think that's it. And there's as if there's this incredulity that could really be the explanation. So deeply entrenched is the idea that people in poverty just do bad things. And in fact, well, I'll come back to that. The thing I want to talk about today that I find really interesting is why is it that people, it's such a simple idea that maybe people in poverty are just doing the right thing given their context, that why is that so difficult to sort of get across to people in a way that they find compelling? I've been thinking about this a lot, and I think it relates to something related to the fundamental attribution error in psychology, which I'm going to call context blindness. When we see people, we can think of them as people, and that's something that sort of we can simulate what's going on in their decision making, but we somehow can't see their context. We only attend to them as decision makers, but we kind of import our priors about the context into our simulation of them as decision makers. So, for example, why would I go to Pizza Addict? It's only 150 meters from my house. Well, I might go there under certain conditions. I might go there if I was super stressed, right? I was just totally stressed out. Something had done my head in. I just couldn't think straight. Oh, I'll just go to Pizza Addict, Or I might go there if I just got into town and I was really tired and I was, I didn't know any better. Or I didn't know that there were other places that were open that were better and so on. So when I see people who have to subsist on very low incomes in Pizza Addict, I just think, well, that's what they're doing. Oh, they're really tired and stressed. They've got a scarcity mindset. They just can't think straight. They're so depleted from being oppressed all day that they just kind of can't think straight. So I import my context, into my explanation of the behavior of people who are actually in Pizza Addict for a completely different set of reasons. Okay, and may represent those reasons, very well and understand them. Right, you can feed a family of 4 for £10 in Pizza Addict. Similarly, would I have had a child at the age of 17? When would I have decided to do that? Well, only if I was having some kind of major life meltdown, probably, because there'll be obvious costs for me as a middle-class person to doing that. And my whole kind of world wasn't set up for that being a thing that might happen. So the only reason I can think of that I would do it, are reasons to do with kind of bad decision-making, being tired, being stressed, having not understood contraception and these kinds of things. So the fact that there might be another group of people whose context means that they make that decision, for perfectly sensible reasons that are different, is something we seem to be incapable of representing. And so the deficit model that somehow this is just momentary madness by people living in poverty, becomes very entrenched in the way we think about this. And why does that matter? It matters because of the kind of interventions we come up with. Okay, so things like the UK's 10-year teenage pregnancy strategy, this was millions and millions of pounds were spent on this program. And the kind of interventions people came up with were predominantly like go into schools, tell girls why it's a bad idea, tell them about contraception, because the only kind of possibility that we can even represent to ourselves for why they're doing this is that they don't know any better, or that they don't understand contraception. And in fact, although the rate of teenage pregnancy fell dramatically over the course of the strategy, but it had actually been falling anyway since the early 1970s. So perhaps that's not, perhaps that was just spontaneous changes in the background rate. But when you evaluate the actual interventions, these educational interventions through randomized control trials, it doesn't look like they did anything at all, and they were very expensive. Right? So my perspective would probably predict that, right? That you do these interventions, they wouldn't be very good ones because they're not getting at the real reasons that people are doing this, and indeed they don't seem to have been effective. But nonetheless, someone in government thought it was worth spending tens of millions of pounds on this stuff. Okay, so that's interesting. And similarly, we have a whole industry related to interventions to label foods and give people nudges and have calorie counting apps and all of these kinds of things. And that might well, be very effective at the margin for certain kinds of people, who are kind of on the cusp of eating more healthily anyway. But does it get to the people who really actually need the intervention most, right? Or need better health most? Probably not, because they're actually probably just facing a really severe cost constraint. There's no amount of telling them that certain foods are high in sugar, are really going to make any difference, because, as I've said, that may just be what they have to do. So I think if we take the sort of argument that I've made today at all seriously, it's really quite far-reaching in its implications for how we think about public health, okay, and how we think about the locus of intervention. And what I was going to say is another reaction I get, as I say, a lot of the reaction I get to my work is just incredulity. You can't really think that's it. And then another reaction I get, which is very charming, really, is that people come up to me and go, "Oh, we love your work. We love it because it's so destigmatizing for working class communities." Right? You're not saying they're getting it wrong. You're not saying they're a deficit. They're just saying they've got a different way of being, and it's great. And we're really going to take on that lesson in developing our intervention. And I say, "Yeah, and what's your intervention?" They say, "Oh, we're giving them an app so that they can make better decisions," or we're giving them an app to remind them what foods are healthy. And it's like, okay, so you're taking away from my work everything except actually the central point of my work, which is, that's probably pointless. Okay, so if you sort of took this seriously, and certainly if you made a sort of, I'm exaggerating for the sake of an argument in a talk, because I actually think there's more you can do with interventions at the margin. But if you sort of take the thrust of this work seriously, it's really quite radically challenging to really what those interventions are and sort of why they should exist, and how meaningful they are and how good they are as a way of sort of spending public money. A response I often get at this point is people say, "Well, okay, fine, but I can't remake Britain to be a socialist utopia, but people will pay me for developing intervention to get people to eat more salad, right?" And if you're saying that the intervention to make people eat more salad is a redistributive revolution, I within my research project, I can't really trial that, but I can trial this nice shiny app or this nice labeling of, or this nice leaflet about salad or something. And so it sort of behooves me, and I think a lot of people intuitively sort of agree with my perspective, but their day job is making leaflets that, promulgate the benefit of salad or whatever. So it does behoove me to say, well, what kind of interventions do I believe in? But I suppose that, the strongest statement of that I could make is, if you take this kind of work seriously, then what you need to change is not at the level of the individual person, but at the level of the whole context. Okay, so actually, you need to go upstream of the person who's already walked through the door of Pizza Addict to understand why why do they find themselves so poor that they've only got £10 to spend on their family's food. And that's where it becomes quite interesting, because you start to think, well, what is a health intervention anyway? For example, could universal basic income be a health policy? We often think of it as an economic policy or a social policy or something that's philosophically desirable. And so this is work I'm doing with Matthew Johnson, actually saying, well, people in public health could talk a lot about the need for upstream interventions, what would be an upstream intervention. And it couldn't be much more upstream than, for example, universal basic income. So we're trying to kind of hash through conceptually all of the steps in the argument that sort of ends with more healthy food consumption, but actually starts with something really radical like universal basic income. But I mean, that's the kind of scope of thinking that you need to be not afraid of making, right? If you take this kind of argument seriously. I think there's a danger that this argument comes a bit nihilist. It sort of says, well, everyone's already doing everything optimally anyway, so there's really no point in trying to sort of talk to them about anything. You just need to, change society. And I think, I agree, we do need to change society. I think maybe it's going a bit too far to say there's no point of talking to anybody. But I do think we need to think much more carefully about the reality, their lived reality, and why there might be reasons for the things that they're doing, and why we might actually misunderstand those when we come in as researchers with all of our tacit assumptions about what constitutes rational or sensible behavior, which is not often informed by any really serious understanding of people's context. Okay, I'm coming to the end. I just want to say that this was work that I sort of have been trying to start to do, but other better people than me have taken it forward, like my friends Willem Frankenhaus and Gillian Pepper. And so for the more recent kind of instantiations of this work, that would be the best things to read if you're interested in it. I draw your attention in particular to the two papers, the one by Willem and the one by Gillian, where you can see a lot of discussion of all of the topics that I've talked about today. And that's it. I would like to thank you for your attention.
Thanks so much, Daniel. That was really fascinating. Do you want to unshare? Yeah, great. Okay, that seems to have worked now. Super. A few questions are coming in and comments. Somebody says, this is Gabriella, who's a PhD student here at Oxford, says, absolutely fascinating talk, thank you. Are there any studies discussing how the moralizing of healthy foods in public health and NHS drives had led to increased stress in people living in poor economic conditions, and whether this further damages health outcomes as they have increased stress as a result?
I don't know of any such studies, Gabriella, but I think that's, there have been, for other kind of behaviors, there have been such studies. And there's been a lot about sort of fertility and family formation behavior, about, the stigmatizing, the sort of construction of the teenage mum, and why that's actually a stigmatizing thing, and it, strikes against the norms and aspirations of a lot of working class women and so on. But I don't know of any for diet, but I actually think it's really ripe for doing, because, when we say you should eat broccoli and salmon, we're making that's great, but it's a very loaded thing to say to somebody, right? You might be struggling on a low budget. So I don't know of any such studies. I wouldn't be surprised if there were some, but I think that's an interesting terrain that people could explore.
I have another question here from Emma Cohen. Wonderful talk, thank you. I wonder whether you could say a little more on the rational decision-making psychology that mediates the conditions or constraints and the behavior. Is it more affective than is connoted by rational decision-making, for example, such as more largely uninterrogated feelings or emotions?
Thank you for your question, Emma. So I don't personally, when people use the word rational, they mean very different things. And I tend to use rational in the economic sense, right? Which has nothing to do with whether affect is involved or whether it's more deliberative, whether it's colder or hotter cognition. The economic sense is to do with the formal structure of the decision. Is the thing you end up doing the thing that actually gets you closer to your desired consequence, and do you do so in a way that involves consistency, transitivity, and those other hallmarks of economic rationality? So that makes no claim about whether affect is involved, whether it's so-called system 1 or system 2 cognition. I think it's all of this, right? I think probably there's a lot of kind of heuristic satisfying that goes on in all kinds of decision making. I mean, no one sits down and says, when should I have a child, and does a load of actuarial calculations. So clearly they're going around their world, gathering information, and seeing what happened to people who are dear to them and in their social network, observing their parents and their grandparents. They're doing a bunch of stuff like that. I mean, they're not making explicit calculations. but it could be rational in some broader sense of like, a sensible thing to do to achieve an outcome. And there's a lot of affect involved, I'm sure. That's the kind of thing I'm actually interested in studying. What do people in poverty know about their future? What do they think about their decisions? Do they think they're making bad decisions? They might, right? Because it's quite apart from anything else, they might have internalized a load of discourses about it, or they might actually, have good justifications for it. So what people know and how they make these decisions is, something that you could further interrogate. And I've just largely black boxed for the purposes of this talk.
Thanks. Emma asked a follow-up question. She's also curious to know whether you know of or have done work on exercise as healthy behavior in the context of this approach.
I haven't really. So I did done some observational studies of kind of exercise behaviors. So people of different socioeconomic positions really differ a lot, not so much in terms of their total metabolic equivalence of movement or whatever, but in terms of what they do them in service of, right? So, middle class people drive to a gym and do METs on the treadmill, and working class people often do METs as part of their job, and they often do them in a different way. That they're more likely to be moderate rather than intense, and they schedule in a different way. And I mean, an interesting question that I think an earlier talk in this series kind of raised is, when we come up with exercise guidelines, do we, are we really sort of, do we really have in mind people who might actually be extremely healthy and doing very healthy physical activity simply in the course of their work or in their caring duties or whatever? So, do we make those guidelines in such a way that would recognize that in fact you can be very healthy by being chronically active in sort of small, moderate ways, which many people are, just because they're on their feet all day or they're doing stuff for their job. So, it seems to me that if you're doing hard manual labor all day, for example, you probably don't want to go out running in the evening, and that would be completely understandable. That's partly an artifact of the fact we're just sitting around all day. So, I think that people's actual physical activity will be a very interesting thing to study from this point of view.
Thank you. Another question from Daniel Nettle. How do you see evolution playing a role here? You've taken a shot at EEA and sugar, but do you think evolution has anything to add to this understanding?
So thank you, Daniela. Well, yes and no, I think is the answer. So yes, in as much as why would humans be so fashioned that they can respond to their environment in moderately sensible ways that keep them alive, if not for the fact that they're evolved beings, right? I mean, if you just assembled some humans randomly from bits of neuron that you had lying around, they probably wouldn't, they wouldn't have the capacity to respond in some sort of sensible and structured way to the environment that. So at the root of our plasticity is the fact that we're evolved beings who try and sort of protect ourselves and, fulfill various kind of motivations that we have to sort of, remain alive and fill ourselves with food and, keep our families safe and all of those things, right? So, evolution is everything. None of this makes any sense. The whole discipline of economics would be completely senseless if humans weren't evolved organisms that kind of were trying to do some stuff, right? If they were just sort of random collections of biological matter, they wouldn't be able to sort of allocate scarce resources and things. So in the general sense, evolution is everything here. But I sense when you say, is evolution doing a job, you're looking for something much more specific, like, because we evolved from the East African savannah X, we particularly like mongongo nuts or something. And for me, no, not so much. Okay, so I'm a sort of, I'm evolution in the background kind of guy, rather than the sort of, there's some really specific thing that only an evolutionary perspective would get you, which is, humans have some very particular quirk of preference, which is to do with our specific evolutionary history. I'm much more like evolutionary sets up the plasticity that makes human purposive activity, and the ends to which humans deploy that purposive activity make sense in the first place.
Thanks. We have, this isn't really a question, it's more a comment from Mark Friedman. Cuba proves that a change in consciousness towards building human solidarity, internationalism, is the way to change working class consciousness. Impossible for this to occur under capitalism. Big agribusiness pushes cheap, nutrient-free calories promoted by Washington, for example, horrendous school lunches. Don't know if you want to comment?
Well, only to say that, yeah, I mean, I had an interest. I gave the version of this talk before, and I had an interesting conversation with an economist who sort of said, look, the reason that sugar and white bread is cheap is because that's what people prefer, right? So there's a sort of general equilibrium assumption that it wouldn't be cheap, right? The food system wouldn't give us that if that wasn't what we, it's made it cheap because the demand for that is high. And my response was to say, well, that's a bit beyond my pay grade, right? The worldwide food system and to what extent it reflects an efficient market is kind of a bit beyond my pay grade as a humble behavioural scientist. But also, I suspect it isn't true, right? Because we know that actually food production is a highly regulated industry that's subsidised by government and dominated by big corporations who, to some extent, can determine what's available to us at what price, and also produce things in ways that are convenient to them. So, for example, things like white flour was introduced because actually it suits the manufacturers because it conserves much longer, and so on. So, I mean, I'm kind of emotionally with you in suggesting that the kind of stuff that's available to us, the sort of choices that are available, are not just they're not just like the readout via an efficient market of people's inherent preferences. They are themselves constructed by corporations and governments and things that have power. So I guess I'm going somewhat down the road with you in that sense.
Another anonymous question. Thanks for your talk, very interesting. Just a question with regard to the calories needed for those of lower socioeconomic status.
Yeah.
Generally, those of low SES have less leisure time and do less physical activity, so will I think need fewer calories. With vegetables then being somewhat comparative to carbs and fast food, but providing fewer calories, would fruit and veg not be the rational option when it is also conferring a health advantage?
I missed something in the question there, Paula. You mind?
Sorry,
yeah.
So the caloric needs needed for those of lower SES, generally those of lower SES have less leisure time and they do less physical activity, so they will need fewer calories. The cost of veg being comparative to carbs or fast food, but providing fewer calories, would fruit and veg not be the rational option when it's also conferring a health advantage?
Sure, but I'm not sure I accept your premise that people of lower SES do less exercise, because I think often their jobs involve, more manual labour, more moving about, more being on their feet, and often they're doing other things that might involve them having to walk a lot more, for example. So I just don't think, I don't think we have any evidence that that's true. And furthermore, so in the end, I have tried to look at that in the NHANES data set, but the measurements of physical activity are so terrible, right? And I mean, really the only way to get ones that are any good is to put actigraphs on people. The NHANES did do that on a subsample of people about 20 years ago, but the data are very difficult for various reasons. And I was unable to, I sort of struggled to extract anything meaningful at all from those actigraph things. I think the actigraphs are better now. And if they do it again, that will be an interesting source of data.
Thank you. A question from Emily Emmett at UCL. Thank you for the brilliant talk. I'm just wondering about your thoughts on these relationships in other cultural contexts. Could information-based interventions creating healthy social morals be more effective at changing behavior in more collectivist, less individualistic contexts? I suppose it's an effect size question between social norms and local ecology.
Yeah. That's an interesting question. I haven't thought about it. I mean, you're sort of implying that it'll be interesting to talk to you sometime, Emily, about exactly kind of how you're thinking about this. But I guess what you're saying is in a collectivist context that the decision making, the ways that people are arriving at their decisions might be kind of more influenced by conformity or by social transmission in some ways. And so, yes, you could well be right. And I also think that norm effects are real, right? If you give people normative information, it really has an effect on people's behavior. I think that's definitely true. Sometimes I worry about the ethics of that. What if that normative information is not right? It's not actually true, or it's sort of artificially generated. And so quite what's the ethical basis of that intervention? I think it depends what your intervention is. But so in short, yes, I think norm effects are real. I think they probably mediate some of the things I'm talking about. And therefore that you could definitely move them around at the margin. And then you need to think about why you were doing that, and whether that was actually the right thing to do, given the reality people was living in. But so that's another question.
Thank you. Rose Stevens, Oxford PhD student, thanks so much for a fantastic talk. Makes the notion of being an apolitical researcher in public health challenging. Whilst I understand that eating more healthy food has wide-ranging benefits if it can be made possible, however, is having children early as a bad decision, perhaps part of the same stigma that you reference and not something we should be looking at to change in public health?
So I'm just trying to track the negatives in that question. Is it something we should be not looking at to change? Well, yes, I mean, I think that, so there's a sort of critical social science tradition that, you know, you can read this, it's in the work of Arlene Geronimus, it's really clear. And it's also, I'm blanking on the name of a researcher who wrote a very nice book called Teenage Pregnancy, the Making and Unmaking of a Problem. She's up here at Teesside, and I'm sorry, I can't conjure her name at this moment, but there's a critical social science tradition sort of saying, well, actually, why are we, you know, why do we do this? Why do we say it's a bad thing? Of course, the outcomes of babies born to poor mothers are worse. Born to very young mothers are worse than those born to older mothers. But that's because their mothers are poor. It's not because their mothers are young, right? And so if you control for poverty, it's not really clear that that's true. So even if you're just saying, I'm neutrally trying to sort of, if you were neutrally trying to improve the well-being of babies, you know, rather than trying so hard not to make their mothers young, you should really try hard not to make their mothers poor. Right? And then, by the way, the young thing might just follow, you know, as a sort of secondary. But I do think we need to be more critical, really, about the locus of intervention and kind of why we're intervening on things. And also, you know, when we compare the outcomes of people who do behavior A and behavior B, that's often not the right comparison, right? Because the people who do behavior A are much poorer, and we know that's terrible for your health. So what you need to compare is the outcomes of people who do behavior A and are poor with people who do behavior A, so who are equally poor but don't do behavior A, and that's a completely different comparison, right? So, yeah.
Thanks. An anonymous question. I understand that you haven't fully worked out the relationship between fitness and utility, but I'd be very interested to hear you elaborate on this, even if your thoughts are still half formed.
They're not even a quarter formed, anonymous. They're not even like a tenth formed. But I mean, that is, you know, that's a biggie, right? So, and the first thing is, I think the economic notion of utility is often sort of given a hard time, and it's fun to give economists a hard time. I mean, I enjoy doing it too, but I mean, we should only give them a hard time that actually relates to the things they've said. I think the concept of utility in economics doesn't really have any content at all. It just says, if humans are going to kind of trade off their allocation of time and energy across diverse types of goods, all of which they want, there must be an integration of that somehow. And that must be true, right? If I want to decide, you know, I might have one set of motivations to do with eating and another set of motivations to do with opera. But if I'm going to sort of decide to eat before going to the opera, or decide between eating and going to the opera when the two clash, you know, I've got to sort of have some way of integrating those into a higher thing. So there has to be some representational melding of those, even if you don't believe that there's a kind of single locus of value in the human brain. And the way that representational melding is done, I guess, must relate to fitness in ancestral environments, right? You know, we must do it in such a way that, on average, over evolutionary time in ancestral environments, you know, it kind of led to good decisions. But then, of course, you've got the $1 million issue is, to what extent do current environments resemble those environments, or are they just so weird, you know, that we do really strange things because we don't integrate those things in the right way? And of course, the biggie on that one is the second demographic transition, right? We have really small families, and we've got loads of resources, and we can have really big families. And from a Darwinian point of view, you'd think we would. And there's some sort of story about how we've got these various desires to, you know, to have families, but to see them really healthy, but also to have status, and also have time, and also have security, and all of these things. And the way we integrate those has this unselected consequence in these particular affluent modern environments, that we end up having these really small families that, you know, everyone, like, you're all anthropologists here, you've all had the experience of going to Africa, and they say, and, you know, people saying, how many children have you got, you know, and you say like 1 or 2, or in my case, none. And they go, oh, and you're a professor, I'm so sorry for you. You know, that's the first thing they say, because it doesn't make any sense, right? You know, it just doesn't really make any kind of sense by historical standards, but it's something that we all do. So that integration must happen. It must happen in a way that tracks ancestral fitness, but something about modern societies obviously disrupts that relationship. And then it gets difficult, right? Because, you know, which are the things that really are mismatched And evolutionary psychology is very fond of these mismatch hypotheses, and which of the things are actually not mismatch is just you haven't understood the kind of real maximand, and I think that's very difficult. I don't know the answer.
Thank you. Gabriela again asks, how long-lasting are these behavioral decisions? What about people who grow up in poverty and then they become wealthy? Do the behavioral choices continue, or do they?
Yeah. No, I think that's a great question. I think in the general case, we don't know. I do think particularly evolutionary psychology has been over-obsessed with these kind of, in childhood, if you're exposed to this particular cue of father absence or unpredictable whatever, or, that somehow there's this lifelong effect. I mean, there could be some things like that, but my guess is that those effects are small. I think actually people are pretty plastic. Okay, so in things like the randomized control trial of Nicole Dalmont, I mean, people change their behavior over the course of weeks. People are already adults, right? So, and actually economists have known this forever, right? You change the prices of things, people change their behavior pretty much in real time. So I think maybe as a field, we're a bit too obsessed with these kind of, critical period. It has to happen to you early in life, and then you kind of have like a predictive adaptive response, and then you're stuck with this. I mean, there might be a little bit of that, though frankly, I'm a little bit skeptical, but I think mainly people are pretty plastic. Obviously there's some decisions you can't undo, right? If you had a child at 17, you can't then not have had it. So it's a one-time decision. But I actually think, and there are some things like pubertal timing, which is affected by environmental events, which obviously is a whole developmental cascade. You can't just sort of switch that on and off at a moment's notice. But I think many things probably will remain pretty plastic as adults, and we change our decisions as the world changes.
Thank you. I have a question, another question. Is it just my impression, or does behavioral ecology often conflate, one, environment as in the area one's living in, and two, environment as in individual living conditions like income that are actually more properties of the individual? Does anyone ever look at the interactions of these two types of environments, and would this be interesting for behavioral ecology?
So I think animal behavioral ecology does a pretty good job in measuring the environment. And I think it understands that the environment is sort of, is those aspects of the world that are fitness-related affordances for the individual. Okay, so, what's relevant to your environment, how hard the ground is, that's sort of a relevant aspect of your environment because it affords foraging in it or not foraging in it. So I think behavioral ecology does a good job in trying to characterize the environment. And the classic optimal foraging period in behavioral ecology, so the period prior to around 2000, where people, prior to 1995 maybe, people just did incredibly cool experiments where they gave animals experimentally really different schedules of, variability in the food supply and patch, when patch is depleted and all this stuff. It was beautiful work, right? And I think in social science, oddly, although social science is obsessed with the idea that people's environment affects them, we don't actually measure it very well. We just say things like, oh, we use SES, which is like some sort of lumped up indicator of a whole lot of really rather different things. And I think there's a real job of interesting work to do, which is to do with, rather than just saying, oh, this is a low SES neighborhood, it's actually going and characterizing really what is it? What is it about people's lives in this place that kind of that dictates their decisions and affects what they see and affects what they can buy and affects what they smell each day and affects what information they get and so on. And I think that we don't characterize the environment that well. We tend to just like these kind of summary measures, and I've used them all the time. Like, SES or neighborhood wealth or something, but neighborhoods probably vary in many different and kind of subtle ways, and really parsing that out and also understanding, what are the experiences you have if you're there is something I think we've only just begun to do and might help in this kind of work.
Thank you. Emma Cohen asks again, is poverty the cause of the behaviors under focus here, or is poverty a proxy for other causes, i.e. harshness and predictability are often offered as the cause in the literature?
Yeah, I think poverty is the cause. I think all this harshness and predictability stuff is a bit of a red herring. I think, I think poverty is the cause, and I think therefore that's why I'm interested in things like unconditional cash transfers, because then you're intervening on what you hypothesize to be the cause, right? Because so that's a really strong test. Is poverty really the cause, or is poverty a kind of proxy for some other thing that will be much more difficult to change? So I think we should at least entertain the hypothesis that poverty is the cause, because then that's really clear. Could turn out to be wrong. It could turn out to be partly right. Of course, you still have to understand what it is about poverty. I mean, how people experience that and what that kind of does to their life on a day-to-day basis. But I think we should think that poverty is the cause. And I think we should study things like the Great Smoky Mountains study, which is a cohort of people in the USA, some of whom became really quite rich by an unconditional cash transfer scheme for sort of random reasons to do with casino royalties. And everything changed for them. Their health behaviors changed, their psychiatric outcomes changed, everything changed, right? And all that had happened was that they had money that they didn't have before. So I think poverty is a cause, and we need to really focus on that, and at least examining to exhaustion the hypothesis that poverty is the cause, rather than some kind of more diffuse or more cultural kind of thing that for which poverty might be a proxy.
Thanks. Daniel, that really makes me think of the question I've had in my mind is, I just wonder if you could talk a little bit more about the universal basic income, because this presumably can help with the solution.
Right. Well, I mean, universal basic income, I'm interested in for a kind of number of unrelated reasons, but one of the things that that sort of, it actually relates to my previous answer a bit. That's sort of interesting about universal basic income is that for some reason we kind of keep having this we constantly sort of find in ourselves this intuition that we can't intervene directly on poverty, or it isn't really about poverty, it's about unpredictability or harshness, or we can't intervene on poverty. And then I just thought, well, this is an interesting idea, because it's unconditional cash transfer, right? It's just giving people money. Now, in fact, as reviewers are keen to point out, universal basic income doesn't necessarily raise anyone's income. It depends entirely how you set it, and also what the marginal rates of taxation that you couple with it. Right? You can actually design a universal basic income that has any effect that you like, redistribution-wise, including none at all, right? Or including being regressive, right? If you set it really low and then you have, you don't have progressive taxation, it's actually a regressive measure. So it's not intrinsically a progressive measure, though I'd hope it will be designed in a way that would be at least somewhat progressive. But I'm sort of interested in it in that in the unconditionality aspect. Okay, so it just we know that one of the things about conditional benefits is actually they're not very well accessed by the very poorest people because of all kinds of bureaucratic hurdles and stigma and rapidly changing circumstances, all of these things that universal basic income just seems to sort of sidestep. And I kind of like it because it's sort of an interesting intuition pump, because firstly, it's just very directly intervening. If you're claiming that a lot of these things are about living in poverty, then just say, give people more money. I mean, this is the policy that would most obviously do that, and just do it, unconditionally, without any kind of weird, perverse incentives that means that people need to stay poor in order to be eligible for their benefits or whatever. Just give them money and let it be unconditional. So that's one reason to be interested in it. The other one is it's an interesting sort of locus for our intuitive theories about human nature. Everyone goes, well, that seems a good idea, but no, that can't possibly be. That can't possibly be right for all these reasons. And then actually, even when you defeat, often with evidence, all of the individual reasons, people say, yeah, but it still doesn't seem right. It just can't be. It can't be. That can't be the thing. So it's sort of interesting. Would it be effective? Is it the right policy? I mean, it does potentially other things than just raise poor people's incomes. It also makes them more predictable. It also takes away the specter of falling between the gaps. It also destigmatizing. It does a bunch of things. But also, a lot of people say, oh, no one would work, for example. And when there've been unconditional cash transfer schemes, there's not much evidence that happens. So people say, oh, the people who spend it all in drugs. The evidence that there is on unconditional cash transfers is actually people consume less of things like drugs, because they think their life is better. So, so it's a really sort of interesting laboratory in which it will be so interesting to test some of these theories, because it's a very direct intervention. It's like an instrumental variable to intervene on a lot of things that I would claim would be important. And, we sort of find out, which of various intuitions about how people respond are actually the right ones. Paula, you're on mute.
Oh dear, you think you know by now, right? That was a wonderful talk. Thanks so much. It was so interesting, and we're really, really grateful to have you today. Oh, Gabriela saying there is one more question. All right, last quick question. The correlation between poverty and high consumption of ultra-processed foods is a characteristic of Western society. So how does this hold for low-income countries?
Well, that's a good point, and it is. I mean, that work I showed you about poor diet is obviously only true of people who exist under the particular food system of high-income countries, and lots of the things, lots of things reverse, right? When you go to lower-income countries, it's the poor who are really thin, and the rich who are fat. It's the rich who eat high-income processed foods, and of course they're not very rich, and they're not so rich in absolute terms, but they're rich in local terms, and lots of these things sort of flip on their head over the course of economic development, right? So who smokes? 50 years ago, it was the rich who smoked and the poor didn't, and then now it's the poor who smoke and the rich don't. So lots of things switch over as the environment changes. I think a lot of the same principles might apply to developing countries, and of course, there's a long and noble tradition in anthropology of kind of the economics of peasants, for example, and how their kind of particular patterns of risk aversion and pooling of their crops and stuff make a whole lot of sense given their ecology, which is very philosophically aligned with what I'm talking about. Because it's basically saying people on the breadline kind of end up making good decisions, but of course the particular decisions they make are completely different because they're subsisting in a different way. So they're different in detail, but the general case could still be applied, I think.
Thank you. Okay, well, that's it. Just before we go, I just announce that next week, Professor Randolph Messi from Michigan will be talking about sadness, madness.
From Arizona now, Paula. He used to be from Michigan.
Oh yes, he's in 2 places, I think, at the moment. Yeah, sadness, madness, and natural selection. So this is, I think, a lot on his new book.